Now let's talk about a different group of questions, and those questions come under the category of know your program. Program directors, they are not only looking for good residents, they are looking for residents that they fit, or they are good fit, or let's say they are the best fit for the program. So it's important to know your program, to know what you need to sell them, because eventually you're there to sell yourself. You have a set of skills and you want to sell these skills. So if you go to a community program and you tell them you want to do research and you want to be like in academia, it doesn't make sense. And if you want to go to a very niche academic program and tell them you're going to end up in the community, they might take you. But again, it's better to be on the safe side. If you change your mind during residency, like, no one will blame you. But again, you have to protect yourself. So they will ask you, what are you looking for in a program? They might ask you, how do you think you fit in our program? They might ask you, like, why our program? Or what is the ideal residency program for you? How do you think that our program might fit your vision? So there are many ways they can ask you about their program. So what would you do before your interview is you research the program. You go to their website. You ask yourself a group of questions. Is this an academic program or is it a community program? Is it a program where I have like lots of publication, or is it a program where most of the people work there end up opening their own practices and working in a community? Are there any famous researchers or famous research like teachers? Some programs have big names, like some program I did my internal medicine residency in Ottawa, and we have Dr. Wells. He's the person who is the one who found the, or not found, I'm not sure if it's the right word, Wells criteria for DVT and PE. Do they have a specific curriculum or fellowship you're interested in? Again, for example, some programs might have like 10 out of the 13 or the 14 fellowships of internal medicine. Like some programs don't have allergy fellowship. And let's say you want to do an allergy fellowship. So make sure they have that. Or like the other way, some programs have a very like top country niche, like very good cardiology training program, and you want to do cardiology. Okay? Some programs might offer not something related to fellowship, like some programs during the internal medicine training, for example, they offer like ultrasound. Some programs, ICU fellowship also offer ultrasound. Some surgical fellowships, some surgical residency offer you to get hands-on experience early during your residency. Other academic programs for surgical specialties, you won't touch the knife until like your 4th or 5th year. So you have to search those things. Talk to residents who graduated from that program to understand the atmosphere and the vibe. And yes, every program have their own personality. And I 100% believe in this. I was lucky that I came from, I did my residency program, like my cohort, I had a great cohort. Everyone was chill. We really loved everyone. Like everyone loved everyone. We were really supportive to each other. We spent together like best of days, best of times. Like I have great memories. Other programs are very focused on studying, and some programs are cutthroat. Some programs, that's what I heard. I don't know how is it, but like my program was great. So like every program have their own atmosphere, and when you go there, you're going to end up acting like them. So if you're a person who is like more laid back and you like to do chill things, look for that program. It's not wrong. Like you have to take care of yourself. If you're a person who is like achiever and you like worry about the prestige and you're going to end up in like very top, like big name, that's okay. But talk to the residents and see like how is the atmosphere there. Go to the webpage, read their mission statement. What is their mission? What is their values? Research the opportunities that are in the program. Research extracurricular activities. Some programs offer like global health. Some programs offer clubs to residents. Some programs offer like things that you might enjoy. So look into that. What kind of patient you will see? So if you go in a program that is located in a big city, you're going to end up seeing high volume, but you're going to see the nitty and the gritty, like the very rare things of that. Let's say you want to do like cardiology fellowship, or let's say you want to do, let's say you want to do cardiology fellowship. If you go to a big city, you're going to see the rarest of congenital heart diseases and the sickest patients. But you have to ask yourself, do you want to practice in academia? Do you want to practice in community? Because if you want to practice in community, is it worth it to do like very heavy training? Again, you have to ask yourself. I can't answer this question. You should ask yourself and see like what's the right answer. And opposite is right. Like if you want to do something that is like mainly community and you want to go to a small program, you want to like you enjoy the small town vibe. So you have to see like that if you like, you have to think that if you go to a small town, you will see more bread and butter, and you're less likely going to see the very rare conditions, because like those are usually sent to a big centers. So what is more important to you? Where do you live? Or do you live like near your family, beloved ones, or like seeing the very rare things in medicine and very like specialized things in medicine and get that exposure? There is no right or wrong answer here. There is you decide what is right, you decide what is wrong, because eventually you're going to become a physician. And the long run, at the age of 40, you're going to look back and you will decide what was important for you. So, what is their match rate? This is important. Like if you are going to a program where the match rate into a fellowship or like the pass rate of a board exam is low, that is a red flag, because like they might be overworking their residents. There might be not like really adhering to the guidelines of like work hours, and that's not good. Like also something else can sometimes happen. Like if you go to a program and like you are with other 4 or 5 residents and like 3 of them are on maternity leave or paternity leave, like this can affect, like you're gonna end up doing lots of calls. Like now, like even dads, fathers take paternity leave, so you have to take that into consideration. Find 3 things that you like about the program, you think it's important for you. This is very important. Like for me, when I applied, the important things were the point of care ultrasound training, the early exposure to ICU and emergency and critical care. Those were important things for me, and I talked about them in my interview. Create a table. This is very important. You have to create a table and compare different programs. Are they community? Are they academic? What is their mission? Their admission rate to fellowship, their board pass rate, the vibe of the program, the clubs available, the things that you like available, the extracurricular things available. And very important, I can't emphasize this. Read about the city. Where do you live for the next 2 to 3 to 5 years, and maybe your lifetime is very important. Like, I don't like big crowded cities, and I prefer more cities that can offer me nicer, easier commute. I just like can't really stand spending hours in the subway, and I like to drive my own car. I don't like to be in the subway. Like I have nothing against subway or people who like the subway. It's nice, but I like my own car because like I usually listen to my own audiobooks. I like to be in control of my time. I like to be in control of my environment. So like big cities and traffic don't match my personality. Other people like love the subway. Some people hate to drive and prefer to live in a big city and live in. So you have to read about the city. You have to read about the infrastructure about that city. If you're an outgoing person, like for me, I like running, I like biking. I need a city where like it has a nice bike path. I need a city where I can just go open my door and go to the street and run. I can't do this in big cities where like it's very crowded and like it's like you wake like from 4 a.m. people are in the streets and you can't find any quiet moments. Read about the city. Are there any like is it multicultural? Does it represent your ethnicity, your background? Are there any restaurants that you like? And I'm not kidding, like those are important things. Like, don't tell me you're going to suffer through residency for 2 to 3 to 5 years. Like, it does not work like that. Residency, it's a marathon. It's not a sprint. So make sure you go to somewhere that you like. Okay? Those are my words when it comes to how to answer these questions, and then we're going to move on to the next slide to see how you can structure the answer.